Hey everybody, Sarah here, and for today's video I wanted to show you guys 8 moves that you can easily do to help reduce pain and prevent injury. I'm sure a lot of you are exercising more, trying to get fit and healthy for this new year, and that's perfectly fine. It's just something that we don't think about when exercising is the smaller muscles in the body. We like the big fat burn and the big muscle growth, so we focus on the big muscles and the big movements, which is fine. They do a lot of good things for us. But the smaller muscles often get neglected because they don't really burn fat. They don't cause or they don't lead to weight loss. What can happen, however, is if we don't pay attention to these smaller muscles, is they're often the source of a lot of pain and the cause for injury. These smaller muscles are the ones that stabilize your joints and kind of hold everything together. For this reason, I like to call them stabilizers. And they often suffer from one of two things. So the first thing that can happen is we don't use them enough. And when muscles don't get used, they get weak, and when they get weak, they can't hold their shape, so they actually will lengthen. And then when that happens, they can't stabilize. They don't have the resistance and the tension to stabilize the joints properly. For example, muscles that are weak and lengthened due to poor posture are unable to hold the spine upright. The second thing that can happen is that the muscles get overused. And as we all know, muscle fibers are like little strings. So let's say this is the muscle fiber. So when the muscle fiber gets used, they break and they stretch and they rip, and then they repair themselves. But each time they rip and then repair themselves, they get a little bit tighter and a little bit tighter until they lock and they joint and they knot up. And this shortens the muscle so that it can actually pull on your joints and make your bones and body shift and move in a way that it's not supposed to. For example, tight hip flexors can pull the pelvis forward, causing what's called an anterior pelvic tilt. This increases the curve in the lower back, which can lead to back pain. Whether or not you are new to exercise, you always need strong and flexible hip flexors in order to move properly and have a good range of motion. So when you're executing your workout or your big movements, you reduce pain and injury, you get stronger and just far better health-wise in the long term. Now, 4 of these are going to be more strength-oriented, and then 4 are going to be for flexibility. With these strength exercises that I'm about to show you, proper form is absolutely essential. So take your time, do them slowly, make sure that the body is moving the way it should so that the muscles can get the exercise they should to help stabilize the joints in a way that is actually beneficial. Start with your feet shoulder width apart and just rise up onto your toes, making sure that your ankle stays lined up between the first and second toe, and hold for a brief second at the top. Do this move slowly so that your ankles don't bow out or cave in as you come up. If you need to, you can use a chair or the wall to balance. Use a step or a stool to execute this move, making sure that your abs are engaged, and again doing this move slowly. If you need to increase the intensity, you can use your arms to create more challenge for your core. Be sure when doing this move that your knee does not go past your toes, and that you come down in a controlled manner, and your heel does not come up off the stool. When executing this exercise, make sure that your core is engaged and your spine is neutral. We also want to make sure to squeeze with the glutes as you reach with your shoulders, and go slowly so that you maintain control. If you need an extra increase in intensity, you can go on your toes. This exercise will really challenge your upper back. Start with your head, shoulders, hips, and heels against the wall, and then just raise your arms, making sure that your elbows are against the wall and that your lower back is not arching. When performing any stretch, While some discomfort is okay, it is possible to overstretch and actually rip and tear the muscles to the point that you can do serious damage to yourself. So number one, you should be able to breathe normally or talk normally through these stretches. And second of all, like I said, slight discomfort is fine. In fact, you kind of should be uncomfortable, but there should be no ripping or tearing or stinging kind of pain sensations. If you feel that, you need to reduce the stretch until you get to that discomfort level. This move will stretch out that pesky hip flexor, and you can either do this with your foot on the floor or lift it up and reach behind you to increase the stretch. There are two different ways to stretch out the calves. The first is to do a downward dog, trying to press your heels to the mat, and you can either hold it or alternate your feet. The second option is to use a towel strap or resistance band to pull your feet forward, making sure that your back stays straight instead of arched. We're not trying to touch our toes, but stretch behind the knees and the ankles. Put your arms on either side of the door frame and push your body forward. This will stretch out the muscles in the chest. You want to make sure not to have your neck come forward, and if you are unable to do this with the door, you can use a strap to do so. Just make sure that your lower back does not arch. The piriformis is a muscle in the glutes that, like the hip flexors, can cause a lot of pain when it gets tight. So we want to stretch it out by interlocking our fingers and pulling our knee to our chest. If you cannot do this on the floor, you can also sit in a chair, put your ankle on top of your knee, and then lean forward. And that's it, you guys. Thanks for watching.